Practice on Purpose, where physicians can explore how to set up their career on purpose from the beginning to stay connected to their purpose for their entire career. I'm Dr. Nicole Eull, a health psychologist with decades of experience in healthcare, from the front lines of a level 1 trauma center to the leadership in one of the largest healthcare systems in the country. I'm passionate about physician well-being and creating mentally healthy workplaces. If you want to thoughtfully establish a career that aligns with your values and passions and ensure a long and rewarding life as a physician, then you've come to the right place. Today, we're talking about medical societies and global initiatives, and in general, just a purpose and service-driven view of medical career. Our guest is Dr. Kim Eull. Dr. Eull is the Director of Healthcare Strategy for KCS Inc. and a prime national strategy consultant for the American Board of Family Medicine. She holds national and international leadership positions and speaks globally as an advocate and activist for global health. Welcome, Kim Eull.
Thank you so much, Nicole. It's so exciting to be on the show with you.
So Kim and I have known each other for many years now in some advocacy work and work on physician well-being. We were on a physician well-being project together. So just tell us a little bit about yourself in your own words and what you're currently doing.
Sure. So I'm a family physician by specialty, and I live in California, and I work, as noted before, for KCS, which is a community health center here in Orange County, California. And I also work for the American Board of Family Medicine as a strategic consultant for Prime Registry. So it's really exciting to be able to work with practices that are doing population health and value-based care, and especially because I've had an interest in those topics previously. So I'm really excited about the work being done to help practices and primary care physicians do quality improvement work and performance improvement.
That's such important work. So you are first and foremost a family doc. Could you share with us a little bit of why you chose family medicine and what you did for the first few years post-graduation?
Sure. So I actually went to medical school in England. I'm from England, and so went to med school in London. And after med school, did my intern year in London, which is 6 months medicine, 6 months surgery. And by the end of that 1 year, I was like, what am I going to do? What am I going to do? And I realized that all of my rotations, the ones that I really excelled in, were family medicine based. It was all about continuity, comprehensiveness, having that long-term relationship with patients. I just loved it. And I remember going to a rotation in the countryside. We actually went and stayed with a family doc in the countryside of England, and he would see patients in his clinic and then do rounds and actually go visit his patients in their home, right? And then come back to clinic and see more patients. But it was just this joyful, every day when he came back, he had so much joy in the work that he did. And that really struck me. And so not only was I doing well in those classes, in those rotations, but I realized after doing internal medicine for 6 months and surgery for 6 months that although there was a part of me that was like, I'd love to do surgery. I love doing things with my hands. I'm not built for surgery. I'm not tall enough to reach the table. I had to stand on a wooden box, and sort of be on my side like this for 6 hours. And that really wore on my body. So it was like, okay, what can I do? And it was family medicine. That's what really drew me to the joy back, bringing the joy back for me, which was really cool.
So you have done a lot of different things in your career, and could you walk us through some of the positions that you've held and the types of work you've done?
So, I moved from England to the United States and actually did research for a few years in diabetes in older adults at the University of Michigan. And so, having that research background really helped me understand, where it is that I really want to spend time. It gave me time to really figure out in my pathway, in my career pathway in family medicine, what I wanted to do. So after residency in Detroit, it was great to actually get into seeing patients, I joined a hospital-owned clinic
Mhm.
and primary care clinic in Dearborn and was there for 2 years. And after that, I was getting more and more involved in medical advocacy and organized medicine,
Mm.
joining the American Academy of Family Physicians and doing work there, realizing that I really wanted to be able to have more time and flexibility. So I started my own practice. It was a time where articles came out about the micro practice and the
Yeah.
ultra light practice. And I
Mhm.
thought, I can do this. This sounds like something I'd really love to do. So I opened my own practice, and for 10 years, I was solo, private practice, family
Okay.
medicine, round on my patients in the hospital. I'd see my patients at the clinic. I'd see everyone from preconception to, way in their elderly till they passed away. And it was a fantastic experience. Loved being in private practice. But at that time, after 10 years, I had children by then. I had two small children,
Yeah.
and wanted a little bit more flexibility in my schedule. Um, and decided to do urgent care because I could
Mm.
do 6 shifts a month.
Oh,
And
yeah.
that would be part time and would allow me to do all the things that I wanted to be able to do at home and at school, with the kids. And that was great for that time period. It was a wonderful experience. I worked in Frankenmuth and Saginaw and different parts of Michigan, doing urgent care, and I really enjoyed it. I also started teaching more. So I helped out at a residency program and was a volunteer faculty at Central Michigan University Family Medicine Residency. And I
Mhm.
also started teaching a lot more. And that's how we met through,
Yeah.
AFP conferences where we would teach on physician well-being or quality improvement and value-based care. And so as that pivot happened, I made the switch to administration.
Mhm.
And so I became the director for quality and performance at a company for all the ambulatory and urgent care sites in the country. And at the time,
Mhm.
they had 25. And so that was a fantastic experience of learning different skills on the administrative, more executive leadership style, right? Position. And so did that for 3 years. And meanwhile was also continuing my advocacy work in
Yeah.
organized medicine. So it's been a really long transition in some ways. And the past few years have been working as the national director for clinical and community partnerships at Aledade, doing value-based care and helping others in their journey in value-based care. About a year and a half ago, I decided to make another pivot. And it was at that time that the American Board of Family Medicine reached out to me and asked if I would like to work with Prime Registry. And it's just been such a fantastic opportunity to work with not only the board, but also the team at the Prime Registry, which is part of the Center for Professionalism and Value in Healthcare. And so we work to provide a tool. It was created in 2016 to help primary care physicians do quality improvement work and MIPS. You've heard of MIPS and measures and all of the things that sometimes drive us crazy as physicians.
Mhm.
But this tool really is there to help those practices and physicians make it easy and to do the work easier and to have that data that they need to be able to do that work. So I found a real synergy in being able to do that, but also work at the FQHC where I can do group visits at the homeless shelter. I can
Mm.
help with an API cancer screening project, right? Where we're going and doing town halls and teaching the community about the importance of mammograms and colon cancer screening,
Mhm.
etc. So I've been really enjoying that mix of being able to have clinical work with, administration and also some innovation
Mhm.
and building a career that really matches what I love to do and allowing me time to be able to still continue to do advocacy and community building within organized medicine as well.
Mhm. And I think this is so important because just like, I have said to people as a psychologist, I think that's an amazing career with so many options and choices. And I've had many careers within my career. So anytime, any career day wants me to come talk to them about being a psychologist, I'm there because I want to create that next generation. And I think it's the same for medicine. There's this idea that you pick your specialty, you stick in that box, and that's your career for the rest of your life. But I try on this show to really highlight the so many vast options and opportunities that you can achieve with your degree in medicine, and also that you can do more than one thing at the same time to fill your cup in different ways.
Absolutely.
So you're really
Absolutely.
working at this national level and then also at this very micro community level at the same time and making an impact in both ways.
Yeah, it's just so fun. I mean, the community health center that I'm at, we have multiple different sites, several that are Asian based, like two that are Korean speaking only, one
Mhm.
that's Chinese, Russian, Farsi, one that's in the homeless shelter, and one that does behavioral health and math, and
Mhm.
so there's such a amazing breadth of being able to say, how do we deliver care for all the different communities that we're part of,
Mhm.
right?
Yeah.
And that's really, really brings me joy. And on the other hand, being able to tap into the research and the advocacy and the work that the board is doing to improve professionalism and also maintain the work that we as family physicians do every single day, and to show
Mm.
the value of the work, the comprehensiveness and the continuity of it. It's really amazing. And so, whatever specialty you're in, whether family medicine, which of course I think is the best specialty because we are pluripotential stem cells and can do all sorts of things, and have opportunities for lots of different avenues. I have so many friends who are, doing sports medicine, or they work in correctional medicine, or they're doing hospice,
Mhm.
right? They're doing more OB, they're doing more pediatrics, they're doing more older adult care. They're going to the sidelines of disasters,
Mhm.
right? And being able to help out. All of these things can really tap into what I call the Ikigai,
Yes.
right?
I know
The
you'd love to
reason
talk
for
about that.
being.
Yeah.
Yeah, I love talking about Ikigai because that's a Japanese term. It means reason for being, the reason why you get out of bed every day. And one day, hopefully, we'll have more discussion about medical Ikigai and what that means. But I think that if we can get everyone to have their vision, their mission, their passion, their vocation, what they're good at, what they can be, what they can give the community, and what they can be paid for, all of these different intersecting circles, and the center of that is your ikigai. If you could find that spot, whatever specialty you are, and whatever stage of medicine you're at, whether you're, a med student, you're pre-med, you're a med student, you're resident, you're in your early career years, your mid, your late career, finding your ikigai is so pivotal to building the infrastructure to be able to survive medicine and to do well, to thrive, and
Right.
to enjoy your career.
And it's so important to figure that out, or at least have an inkling of where you're headed. And I truly believe to choose your career around that rather than take the path that's conventional or the path that sounds good on paper or the path of least resistance. You've alluded to, you said, oh, I do all these different jobs. I've had all these careers. And while I was doing this, I was involved in other organizations. And that's putting it lightly because you are always traveling, always going to different organizations and speaking at different organizations and doing advocacy work. So you hold leadership positions in quite a few national and international organizations. So I want to dive into that a little bit. Can you describe those groups and how you got involved and what your current roles are?
Sure.
If we have
Yeah,
time to cover all of that.
I know. So it all started when I was in residency, when my senior resident and chief said, "Get in the car, Kim." And I was like, "Why? Where are we going?" And he said, "I'm going to take you somewhere. It's going to change your life.
Oh, wow.
It's going to change your life." And I was like, okay, we're definitely not going to the supermarket. We're not going to Myers. And we're going somewhere else. And sure enough, I end up, an hour later, we end up at the Michigan Academy of Family Physicians headquarters for a meeting. And that's my start, from Dr. Angelo Podsalis, who was the person that introduced me to organized medicine. And
Mhm.
so I got involved with the MAFP, and went to committee meetings and then was on their board and made my way up, became president and board chair of the Michigan Academy, and then got more involved, even more so, with the American Academy of Family Physicians, and served as a minority delegate for their Congress of Delegates and their convener for some of their conferences, the NCCL conference. And then now I serve as the on their delegation, the AFP delegation to the AMA. I also do social media for them, so I've served as a social media ambassador. And sort of from a world perspective, I'm part of WONCA, which is the World Organization of Family Doctors. And that's been a fantastic organization to really get to be with other family physicians from around the world doing amazing things. It's an incredible community, and have served as the chair for the special interest group in health equity. And now I'm the North America representative, the US representative for the Working Party for Women in Family Medicine,
Wow.
North America region. So it's a very busy time, but it's a wonderful opportunity. And as sort of on the state level for California Academy of Family Physicians, I'm the speaker and will be
Mhm.
president-elect soon.
So,
So
what advice would you give to
lots of
people
news.
if they want to get started? You got
Yeah.
into a car with a mentor, and that's where your journey
That's
started.
exactly it. That's exactly
How
it. So
how
if
do people get
someone,
started?
yeah, if I call you and say, hey, get in the car with me, I'm going to take you somewhere that's going to change your life, go with that person. Hopefully,
Mhm.
it's a mentor that you trust.
Mhm.
No, seriously, get involved with your specialty organization, whether it's, the AAFP, and then you can get involved with the state level.
Mhm.
So whatever it is, whether it's, for example, the AMA, we have the California Medical Association, the Michigan State Medical Society,
Mhm.
like wherever you are, and you can join these organizations even as a medical student, right? Get involved. And
Mhm.
actually, most medical schools and medical students have membership to the American Academy of Family Physicians. It's a
Mhm.
wonderful way of getting involved, learning what it's about, and building networks
Yeah,
that
right.
will, and friendships that will carry you throughout your career. I
Mhm.
feel so very blessed to have friends now around the world, in most countries, where I can call and say, hey, I'm going to be in Spain. Can we
Mhm.
meet up and talk about family medicine or what's happening, in the world right now? And it's infrastructure that really is such a blessing. You will get so much more than you put in, but at the
Mhm.
same time, the more you put in, the more you get out of it. And so
Right.
that's what I would encourage everyone, if you're early in your career, especially, get involved, stay involved, and find your people. Find the
And if
people that bring you joy.
and if you choose to follow Dr. Yu, you will see that she's on a plane traveling off to different conferences and events quite regularly. I wonder, just in so much volunteer work and advocacy and national and international involvement, you're doing quite a bit of travel. Do you have any thoughts or tips on staying well as you're always on the go?
Yeah, I mean, my previous job that I had, for close to 4 years, I was traveling almost every month,
Hmm.
for at least a week out of every month. And it was really hard. It became quite challenging at times. But the best thing I can tell you is to have two sets of bags for your toiletries,
Mm.
so that you can just have one bag ready to go. If you're able to have one bag with clothes in it, and all the stuff that you need, so you don't have to repack. You just pack that bag and you come home, you wash the clothes, you repack that, right?
You
And
just
you
wear
just
that
keep
outfit.
that bag, and yeah, you just keep that out. Those outfits, you'll see me in the same blue suits that I bring, and black suits that I bring from my conferences. That really helps.
Hmm.
Connecting, having a time where you connect with your family, knowing when you're going to text them or call them is really important.
Hmm.
Um, maintaining whatever schedule that you have. If you love to exercise in the morning, keep going. I'm not a yoga person. I know that others are, but if you love to do those type of activities, don't stop just because you're traveling. And then
Right.
watch what you eat. Obviously, don't change your diet too much from where you're at. Otherwise, you will put on a lot of weight if
Good tips.
you eat a lot of junk. So, I think sleep is something that we need to really watch. And
Mhm.
sometimes instead of, oftentimes I'll be on a plane, I'm like, I need to read this much material, or I need to
Mhm.
finish slides, or I need to do such and such. And I make the decision to say, no, I'm actually going to sleep right
Right.
now. I need to
Mhm.
rest. I need to put my headphones on and not talk to the person next to me, which I love to do.
Yes, you do.
Um, but just to rest and to really spend time. I think
So
if
go ahead.
I think if you know your limits
Hmm.
and whether you're extrovert, whether you're introvert, especially for our introverts and ambiverts, you might reach a level where you're like, okay, that's it. I'm done. I need to
Yeah.
go and regroup.
Hmm.
Know that level before you hit it and before you surpass it,
Hmm.
because even though I'm a high extrovert, I have moments where, especially if I'm sleep deprived, where I'm like, oh, okay, I need to take a few.
Yeah. Yeah.
Go
Maybe
back to your
skip,
room.
skip an
Yep,
event
skip a
or
session. Yep, and regroup.
yeah. I'm a big napper. I like to take a little nap here and there. So just step away, take a nap
Absolutely.
for 20 minutes and head back in. So Kim, you are a natural networker. I've seen that in action in many different places. And I know that you love to connect people. So what value do you find in networking and in networking organizations?
Oh, it's priceless. You can't purchase good networking. It truly is relationship based. You have to get out there and just spend time to get to know people. And networking to me is, hmm, it really brings life to a career.
Hmm.
Because if I look back to all the positions I've held, the past three, four positions that I've had is because of networking.
Yeah.
I
Yeah.
haven't had to, apply and fill out forms and, all of that type of thing to interview in that manner, right? It's always been, hey, someone I know that's approached me that said, we really could do with some help here. How about it? And then I go for all the interviews and fill the forms
Mhm.
out. But those type of opportunities don't come along if you just stay in your room and just buckle
Right.
down, just do your work, right? You've got to get out, you've got to network. Um, it's also important for, especially when you're doing advocacy work or even just work in general in the community.
Mhm.
It's really hard to build a platform or to have a voice if you're not able to build those networks that can really help you build
Mhm.
connections with
Yes.
community-based organizations or to legislators or to
Right.
leaders in organizations that are doing the work. We
Mhm.
can't do everything ourselves.
Right.
We need each other, right? And so this concept of teamwork and together we each achieve more, like, it's just definitely, definitely something that I hold dear to me and
Mhm.
realize that I can't do everything. I need those connections
Yeah.
to really know how to help others, right? And how we all can help each other.
I've noticed that a lot of doctors are not on LinkedIn. And I always think that's a missed opportunity that to grow, to expand, to connect, to be open to opportunities that I don't know why, but a lot of doctors are hard to find on LinkedIn. So, and
They
other
really
networking.
are. And I think part of it is it's a social media tool that has been seen as more, oh, you only get on LinkedIn when you need a job,
Right.
right? And instead of it being actually, it's a really great resource to share information in general, especially with different changes with different platforms,
Mm.
where we want to be more sort of just neutral, right? And not just be an echo chamber.
Right.
Have it being on LinkedIn is actually a great way of sharing really balanced information
Hmm.
that is evidence-based and that really can help other physicians and other medical students know what the benefits are for,
Right.
whatever treatment or thing that you're working on. So
Yeah.
I love LinkedIn to be
Yeah.
able to share, especially the work that I'm doing. It makes sense to be able to post about it. So I'm actually going to have a podcast kind of thing, not quite podcast, but something called Prime Time with Dr. Yu that we're starting tomorrow. And so I put it on LinkedIn,
Yeah. Right.
because it's a fun thing to be able to share information.
Yeah, I think it's a great tool. So, one of the things I want to make sure to cover is that you have something you do very quietly but very fiercely. You lead and have led many very notable disaster relief efforts. Can you share some stories about those efforts and the challenges that you face?
Absolutely. Absolutely. Started uh with several different hurricanes that occurred
Hmm.
in Texas and then in Florida, and then notably Hurricane Maria in 20 Puerto Rico.
Hmm.
And at the time, I remember when Hurricane Maria struck, I have a lot of friends who are family doctors in Puerto Rico because they come to all these meetings that we go to, and every year we would meet up. And so I have a lot of friends there, and I remember contacting them and saying, "Hey, what can we do to help?" And they were like, "We need power. We have no power." And so I did one Facebook post and said, "Need help for our docs in Puerto Rico. I want to raise money to buy generators for them.
Hmm.
Who's in?" Right? And pretty much, in one weekend was able to raise $50,000.
Wow.
It was incredible.
Hmm.
And the Indiana Academy of Family Physicians helped be the repository for that money,
Hmm.
and very kindly donated their time to be able to really help with this whole effort. And it grew from sort of just one Facebook post to a whole coalition. I had physicians from around the country,
Hmm.
and in Puerto Rico working together with a Jeep brigade of physicians who would go to the airport to pick up supplies. And so we actually raised over $120,000. We had several tons of medication, food, water, 66 generators, two that we brought from the mainland, and 64 that we bought in Puerto Rico. And these Jeep brigades would pick up and then distribute throughout the island,
Unbelievable.
to health centers, to convents, to nursing homes, to um, orphanages, to places that needed supplies and water and food.
Hmm.
And the Puerto Rico Academy of Family Physicians were incredible. They had so many physicians that helped out during that time, and other organizations. So BRIAC is one. We have several others that are part of this coalition of physicians
Hmm.
that are multi-specialty that helped out from around the country, Ashley Saucia and others, that really helped. I mean, they would, go and I would say, I need someone to bring um, a nebulizer unit or an oxygen compressor, right, to Puerto Rico so that we can get patients off the island.
Hmm.
And they went and
Wow.
purchased the item, flew it. We were able to arrange with different organizations to get planes that would take them to Puerto Rico and then bring patients back. So it was an incredible um, 6 to 8 months of my life
Yeah.
where, I was doing that, and seeing the impact that these physicians and medical students and residents and communities were banding together, going door to door, bringing food and water to people when they most needed it.
And you said that was one Facebook post, and in a weekend you raised $50,000. But really, what that
Yeah,
was a lifetime of networking, connections, building trust,
correct.
camaraderie with colleagues, and then they trusted you, and they all came together and wanted to support you and things that you believe in. So that really
Yeah.
is a lifetime of curating connections and bonds that led to your power to do that.
No, I was very thankful for all that got involved, and truly those friendships, I mean, they're still all my friends today. So
Yeah, sure.
it's great. And since then we've had multiple, different disasters on Barbados and in the Bahamas and other parts of the Caribbean. And now, with different things that are happening around the world, we're continuing that work
Mhm.
with different physicians to ensure that communities that aren't as resource heavy
Mhm.
are able to get the resources they need to be able to deliver the care that they want to be able to care for their patients. And so that's something that is truly a heart mission for me
Yeah.
and something I love to do.
So you do another kind of connecting that I think is really interesting. You've created a small and group that has, I think, exploded now on Facebook, a physician moms group, or was it family medicine moms group? So, what
Yeah.
have you learned from that project? And tell us about it a little bit.
Yeah, it's called the Physician Moms and Family Medicine Group, and we have over 3,000 physicians from around the world. I think it's close to 3,500
Wow.
physician women from around the world, predominantly North America, but we have physicians from every continent, and it's just really been fantastic to see the connections, the support, the sharing of information, the friendships. When we go to meetings, we actually get together at these meetings and go out for dinner or go see a show. When things are hard right now. It's been really wonderful to just get together and
Mhm.
be on a Zoom, and just connect with each other or call each other. And so I've found it to be so very helpful for my own well-being and mental health to be able to have this community of incredible physician women from around the world to have, at our fingertips,
Mhm.
right? And so we've had cases where someone will fall sick and they're out of state and they're in another state, but they'll say, I need someone in North Carolina that's at Duke. And then someone will say, well, I know so and so who works at Duke. And so we're able to connect these physicians with other physicians that are able to help them in their journey. And we've seen it, even in Spain or in Nepal or in other countries, right? And so it's been a sort of ohana of family medicine, where ohana is from Lilo and Stitch, means is family. Ohana means family in Hawaiian, and family means no one gets left behind or forgotten.
Mhm.
And I like to say that in family medicine, we make sure that we are all ohana, right? And so having PM and FM really has brought me so much love and joy and friendship, and it's been really fun too.
So I think that's so beautiful, and you have been involved in so many different things. So, what lessons have you learned in your involvement in all these vast initiatives and organizations?
Yeah. Lessons learned, I think you really have to, firstly, your Ikigai, right? Number one, find your Ikigai, figure out what your mission, your vision is for your life and your family. Really figure that
Mhm.
out and what you want to do. I think that's really important. I think preservation, self-preservation is not a bad thing. It's a very good thing. And so if you're not in a place that values you, that you feel your voice is not being heard, I think it's important that you make changes to be in a place that really wants you there, that values you, and that really can bring you
Mhm.
to the best place that you can be, right? You want to be in a place that supports you. And so that is very important. And the third is build your community around you, build that ohana. It's almost like a resiliency wall. When you have
Yeah.
that community around you to support you, everything gets better,
Mhm.
right? and to ensure that those avenues, it's okay to change and pivot. Like even in my journey, I didn't stay in private practice forever.
Right.
I didn't stay in administration forever. Now I'm in FQHC and also in, quality improvement work. So it's okay to change and pivot to
Okay.
where you need to be. And that's exciting.
So how do you find balance and take care of yourself with all of this going on?
Well, I find that sometimes there are days where you may be like a little like this, right? You may be a little, if you've seen the movie Inside Out.
I sure have.
This is my little buddy anxiety.
Hmm.
Or you may, be very angry,
Angry. Hmm.
right? But we all want to find a little bit of joy, right? A little bit of joy. And so I found it important to really recapture joy. And you can recapture joy by sharing joy with others. That's one thing. I do this activity with balls where we throw balls at each other, and it's really fun. But more than just recapturing joy and sharing joy, finding joy yourself. And for me, that involves this.
And
It
for those of
involves
you who are just
joy.
listening, she's wearing her Mickey Mouse ears or her Minnie Mouse ears.
My mini ears. It's not just wearing ears, but going to Disneyland, which is only a half hour away from me now, is definitely my happy place. It is one of the happiest place on earth. But finding your place, whether it is at Disney, whether it is on the yoga, whether it's at the gym, whether it's at the Taekwondo place, whether it is in your basement doing crafts and making quilts, whatever it might be, find that place and spend time to cultivate it
Hmm.
and to enjoy it. Because before you know it, it's gone.
Yeah.
And whether it's Disney or travel, I love to travel.
Hmm.
So spending time being intentional about penciling it in
Yeah.
is
Right.
important. Yeah.
So, of all the things that you do, what is your favorite thing that's really inspiring you and filling you up right now?
Oh, right now it really has to be, that's a really good question. Right now, what I really love doing is really connecting people with the resources they need, whether it is, at the ABFM with Prime Registry, or whether it is at my FQHC with, information on group visits, or whether it is with PM and FM. It's just this idea of connection.
Hmm.
Right. How are we connecting with others to ensure that they are in the position to be in the best place that they can be? I
Hmm.
want to be able to say, you know, our lives are very finite. I remember not too long ago being on a podcast where someone asked me the question, as a late career family
Oh,
physician,
okay.
and I almost fell off my chair, but it was a real wake up call in some ways. I was like, wow, it has been 35 years since I graduated from residency, and I have limited time left. So what can I do to help others
Hmm.
really propel in their career, to enjoy the career that they want in family medicine, or as an office manager, or as a community health worker, whoever it is that I'm working with, how can I really help them enjoy that? Or even for my family, how can I
Yeah.
support my family the best that I can?
Hmm.
Right. And that's where I feel I'm at right now, is to get to that part of connecting with others and making sure that they're connecting also with their purpose.
So, you do a lot of things, you take on a lot of challenges. What are some of the challenges you're facing right now?
Challenges right now. Well, obviously, the environment we're in right now, politically and just in general, has been quite challenging the past few weeks. And so that has been interesting sort of mind shift, right? Where in many ways as physicians we compartmentalize, we're able to compartmentalize and really decide, well, okay, today we're going to just focus on this. And so for me, it's really been um, not challenging so much as just more intentionality about compartmentalizing and saying, at the end of the day, what is the mission? And Sean Martin, who was CEO of AFP this past weekend at a conference I went to, said, we didn't choose the environment, but we did choose the mission.
Mm-hmm.
And so, the challenges that we face, whether it's at work with, more administrative burden or fear, right? That what if Medicaid goes away? What if Medicare goes away? What if,
Right.
the ACOs go away? All of these different things. What if we have even more measles outbreaks?
Mm.
All of the different fears that we may
Yeah.
have, all those things that make me look like this, right? We have to say that we have to keep on the mission. If we
Right.
keep the mission, if we keep doing what we know to be right and true, we keep doing the preventive health and preventive medicine, we keep taking care of all the comprehensive care that we do as family docs to ensure that patients get the best care that they can get. Um, that gives me some peace,
Okay.
right?
I love that. Yeah. So you are a mentor and model to many people. Do you have any mentors in your own space?
Oh, yes, very much so. I have mentors both um, within the community here and sort of out in the world. If I think of my first mentor, it's Karen Mitchell, Dr. Karen Mitchell, who is a family physician who works for the AFP now, but she was a program director at a
Mm.
residency program in Michigan. And we served together on the board for many, many years. And she would just take me to one side and just say, Kim, what about this? Or what about
Mm.
this? And if I had something challenging, I would be able to go up to her and say, can you just help me through this? Help me understand. What is your perspective on this? And she would give me amazing advice, amazing career advice, and also just in general advice as to different things that are happening within the House of Medicine.
Mm.
Um, when I think of people who inspire me and also mentor me as well, Viviana Martinez Bianchi is a dear friend, my
Mm.
dearest friend,
Mhm.
who is a family physician and at Duke, previous program director, now director of health equity, and also going to be the president for the World Organization of Family Physicians,
Wow.
Family Doctors.
Great.
She will be installed this fall. And
Mhm.
she has, in so many ways, inspired me, not only with her commitment to her passions, right?
Mhm.
If there's anyone that I can point to and say she's living her ikigai,
Yeah.
she's living her purpose, she's doing everything that she was meant to do. She's definitely that person for me.
Okay. So a few quick closing questions that I ask everybody. What is one piece of advice you would give to an early career physician?
Not only find your ikigai, but find your joy early.
Okay.
Don't just, grin and bear it.
Mm.
I remember doing an ICU rotation during residency, and it was so grueling. I mean, it really was awful that I would wake up early at 5 or 4:30 in the morning to go skate at the
Hmm.
ice rink at
Okay.
5 a.m. And I'm
Wow.
not an ice skater, but it was during the time of Michelle Kwan and all of that, and I loved Michelle Kwan watching her
Mhm.
skate. So I started taking ice skating lessons at the rink once a week, but then I would go practice every day. And it
Mhm.
helped so much
Yeah.
with finding that joy, that little
Yeah.
bit of dopamine that, got me going through the rest of the day. That really helped.
So you made
And
that space. Yeah. Okay.
yeah,
And what's a piece
find
of
your
advice
joy.
that you would have given yourself in your early career?
I would say imposter syndrome,
Mm.
you need to let it go.
Yeah.
You
Okay.
need to learn to deal with it. And um, don't listen to that little voice on the shoulder. Don't listen to a little anxiety there that's going, whoa, 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 you did terrible on that lecture, you know?
Yeah.
But really learn to appropriately talk to yourself, to have self compassion, and to listen to those around you who are wiser and who can give good feedback so that you can learn appropriately, to not have a big head, right? You don't want to have a big head, but to have self-compassion for yourself, because we are our worst critics.
Yeah, for sure.
And I think that that's something that I wish I'd learned much earlier on.
I saw a video once where a gentleman said imposter syndrome is just your mind signaling that you're leveling up. And that seems right to me. Yeah,
I
you're going to
love
feel a little
that.
uncertain and scared when you're taking on new challenges, and that's normal. And that just means you're at the edge and you're growing, right?
Yeah,
Um,
growing is good.
yeah. So what are you loving right now about medicine?
I love that no matter what, we can still bring the best of science, of knowledge, of love, compassion, and the ability to bring better health
Mm-hmm.
for our patients into every exam room, into every room that we walk into,
Mm-hmm.
that we can bring that purpose, that mission, the values that you hold dear, that we can bring that with us.
Mm-hmm.
And that no matter the earthquakes, no matter the roads flood, that there are like-minded individuals who also love their patients, who also want to do the right thing, who also want to be kind and to show that compassion to their fellow human being.
And
Right.
it's so
And
needed right
so,
now.
yeah, so needed right now. And so I'm grateful that there are communities of physicians who are really taking steps to take care of each other, but also the communities, and to
Mhm.
stand up and advocate. And I'm so proud of those docs and those healthcare workers and clinicians who are really, going into work every day, no matter how they feel, like continuing to bear the burden, but also to bring joy to others.
So, Dr. Kim Yu, what's next for you?
Next for me, some more meetings. I'm excited to be later on going to Korea to talk about value-based care, and talking with physicians in Asia about how value-based care is providing reimbursement for physicians in primary care here. And so they're looking at how to change things in Asia, and so that's really exciting. I'm also looking forward to Prime Time with Dr. Yu, which starts tomorrow, and I also am looking forward to the all-member advocacy meeting for California Academy of Family Physicians, which is in a few weeks. We're going to be talking about resolutions that are important for our specialty and for primary care. And I'll be the speaker for that meeting. And so bringing all of everything that you heard about in the past
Mhm.
45 minutes or so, bringing it to fruition and really advocating for our specialty. So that's really fun times.
So, if anyone wants to learn more about you or check in on Prime Time with Dr. Yu, where should they look?
You can go to primeregistry.org. You can go to my LinkedIn, Dr. Kim Yu. I'm on LinkedIn as well. And I have Instagram at DRKKYU, and Facebook, all the other Blue
She's all
Sky,
out
all of the
there.
others, all over. Find me, and happy to talk with others. Love to meet with everyone to just really talk through how we can have practice on purpose.
And she really does believe that, and she really does mean that. So, thank you so much for joining us today to talk about so many different things that help us stay connected to our purpose and our Ikigai. We hope this show has you thinking about your own career and what actions you can take to make it ideal for you right from the start. If you've enjoyed this episode, please like and subscribe and tell others to join us. We greatly appreciate your reviews and comments, which help us grow to a wider audience. If you want to stay in touch, email me at practiceonpurpose@heyinfluent.com. Let me know what topics you want to explore in future episodes. And remember, Build your practice on purpose to stay connected to your purpose. I appreciate you joining us on this journey. Let's keep exploring together. Until next episode.